The ELPR, or the East London Patient Record, is a collaboration between the hospital system in East London, general practice, social care organisations and mental health organisations. And what it allows one to do is to share data across all systems of care in East London to make safer decision making for patients and often faster decision making.
I have a clinic list tomorrow morning. Before I start my clinic, I always prepare my patient list because I have the advantage of this East London patient record where I can access information about my patients who are going to come tomorrow, so that when they walk in, I know most of their previous and current medical history. So for example, I'm going to see Mr. Brad tomorrow and I have already accessed his previous medical record. The record goes back to 92, so I will know all his relevant medical history and whether he is allergic to any medication, whether he has been tried on any medication, and also any investigation done by his GP on him. I will have access to their results.
My name's Brad. I've come along to the hospital today after being referred by my GP after suffering palpitations and breathlessness, so I'm here for a few tests.
I'm Dr. Ranjan. I'm one of the cardiologists here. Please take your seat. Your doctor wanted me to check your heart regarding your breathlessness. I would like you to see one of our specialist nurse,
Okay.
who is an expert in dealing with this problem.
Brad, would you like to come in? Right, come and take a seat. Hello, my name's Sarah. I'm the lead heart failure nurse and I understand you've seen one of the consultants this morning.
Yes.
So how have you been?
Breathless.
Okay,
Palpitations.
okay. And I understand you've been taking some medications. Do you know which ones you've been taking?
Not sure.
You're not? Okay. Is there quite a few?
Yes.
Yeah, all right. So I'm just going to check the East London patient record to see what you're on and what doses that you're on to see if we can optimise any of those tablets, increase the doses or decrease the doses depending on your symptoms, okay? So from looking at the East London patient record, I can see that you've had some admissions over at the Homerton and to other hospitals within the Barts Health Trust.
Mm-hmm.
Were that for cardiac conditions or for other conditions?
Other conditions.
Okay, so we can also have a look at the letters, which we'll do now.
Okay.
The consultation is now finished with Brad and we'll follow him up in clinic again in a few months' time. But I'll now send a letter to his GP informing them what's happened during the consultation. So the East London patient record was really helpful because it allows me to look at the medications that Brad's on, at the doses, and to see if we can increase any of those tablets. It also shows me that he's had appointments at other hospitals, including the Homerton, and what those appointments have been.
Hello Brad, come
Hello.
in. How are you today?
Not too bad, thank you.
Okay, so it says that there is some problem with your heart, which is causing your palpitations, and you are on the medication at the moment, but they have increased it a little bit. So I'm going to give you another prescription with the increased dosage, yeah? And also I can see the blood test they have done, so I can safely increase your medication as well. Okay, so how are you feeling?
A lot better.
A lot better
than
now,
I
yeah?
was, yeah.
Okay.
Yeah.
Yeah. Today I have seen Brad after his visit to the cardiologist, and also he was seen by the specialist nurse there. I was able to access the East London patient record to access his details, and I am now able to make a clinical decision to increase his medication and also access the blood test so that I can increase the medication safely. And I have also asked him to go for further blood tests and investigations without waiting for the hospital letter to arrive by post. I find the East London patient record very useful and it is changing the way we work.